Time now for the Spine Doc, putting you on the road to better spine health, featuring Dr. Pasquale Montesano, MD, world-renowned orthopedic surgeon and spine and joint treatment specialist at Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, and Naples. Dr. Montesano is a pioneer in the development and application of the revolutionary A2M treatment for lasting proven relief of chronic pain and discomfort in joints. Now, here's your host, Brian Content.
And welcome once again to the Spine Doc, on the road to better spine health with Dr. Pasquale Montesano, MD of Montesano Spine and Sport. You can reach Dr. Montesano by calling 866-79-DR-SPINE, 866-79-DR-SPINE, or visit the website, spinedocs.org, or you can check in with Facebook, facebook.com/Montesano Spine and Sport. Find out more information about one of the top docs in the country who is especially trained in spinal disorders, spinal trauma surgery, scoliosis, other deformities, cervical, thoracic, and lumbar traumas, kyphoplastic surgical treatments, and even platelet-rich plasma, a specialized treatment called alpha-2 macroglobulin, and we're going to get into that a little bit more later in the program. Hello, once again, Dr. Montesano. So what's new in your world? You're a busy guy, I know that.
Well, I just got back from Beverly Hills. I gave a very exciting conference there on arthritis, inflammation, herniated discs. You know, the question is, why can a person have cartilage damage or a herniated disc? And some days they're totally asymptomatic, some days they're mildly painful, and some days they have excruciating pain. Or one of the questions that one of the participants there asked is, he knew that he had cartilage damage in left and right knee, so both knees, but only the left knee ever bothered him. The right knee didn't, and the cartilage damage was similar. And the reason for that is the presence or absence of inflammatory factors. So just because you have a mechanical defect doesn't mean that you have to have symptoms. And that's one of the problems that we encounter in trying to treat patients is you can't design the treatment program solely on the X-ray, solely on the MRI. So we teach in medical school, in residency, in fellowship, that 80 to 90% of a diagnosis comes from listening to the history. And you have to guide the patient, because sometimes the patient may want to tell you stuff that is not really pertinent to what their problem is, what they had for breakfast, what their Aunt Susie's doing. So you have to guide them, and you have to become a good historian. We jokingly say that sometimes WNL, which is supposed to mean within normal limits, it can mean we never looked if the doctor's not looking in the right directions when he's taken the history. So the history will guide you to what the diagnosis is. You then support what your tentative diagnosis is based upon what the patient told you and the information that you elicited from them. You support that with the physical examination, and you further support that with the X-ray, MRI findings. Now, it can't stop there, though, because you can have, on MRI, you can have multiple different defects seen, and you can't be sure which one is really painful. But the point is, Brian, that the findings that you find on MRI may or may not be responsible for the patient's pain. It's not a one-to-one correlation. The next step that's required is the next question is, are those findings inflamed or not? Is there an inflammatory process going on? And that's where we introduce the concept of a biomarker. A biomarker, the NIH, the National Institute of Health, says that a biomarker is a protein complex that either has been or will be identified in the future that in every disease process that indicates the active state of that disease. So in arthritis or disc disease, the biomarker is called fibronectin aggrecan. And there's over 15 papers that have been published on this by now. So it should be common knowledge amongst most physicians that in arthritis or disc disease that the biomarker that has to be present is called fibronectin aggregate. In the future, I'd say 10 years from now, when you get an MRI, it won't just be an MRI. It'll be what's called MRI spectroscopy, where the MRI will also be able to read the chemical composition of whatever tissue you're analyzing, and that will be able to tell you if the biomarker is positive or negative.
Why do joints and such on discs become inflamed? What is exactly the process of inflammation?
Well, when there's an injury, the cartilage tears, the disc tears, and the cartilage really doesn't have good circulation. The disc doesn't really have good circulation. So then the body reacts to that and starts an inflammatory process. We call it an inflammatory cascade, where one protein is converted to another, another protein's cleaved, two cleaved fragments bind together, and there's a whole process that goes on, just like in the clotting, what we call the clotting cascade, okay, when you form a clot. And that inflammatory process can either persist or it can die out. We know that when somebody has an episode of pain, when they injure themselves, there's a 90% chance that they're going to become asymptomatic or relatively asymptomatic in about a month. But there's a 10% chance that the symptoms will linger, and it's those patients that end up in somebody's office, like in my office.
So technically, it should be healed.
It should be healed.
These things should naturally have gone away because the injury itself should be done with.
Correct.
Theoretically.
Correct. Okay. And so when the injury occurs, you get this cascade of events where you have these inflammatory proteins and cytokines that get produced by your body. And sometimes, most of the time, your body is able to clear them. But when your body's not able to clear them, that's when the process becomes active. So in that guy who had a cartilage injury in both knees and only one knee was symptomatic, one knee cleared it, the inflammatory process, the other knee didn't. And that's why you can have good days and bad days. Your injury's not changing from day to day, but your level of inflammation is changing from day to day. That's why if you take anti-inflammatory medication, that can have an effect, that can dull the pain. The anti-inflammatory medication, whether you're injecting it into the joint or the disc or around the disc, or you're taking it by pill, whether it's aspirin or Motrin or Indocin, is dampening or lessening the inflammatory process, and so it's lessening the symptoms. It's not doing anything to the actual injury.
So in trying to combat naturally inflammation, if you have, let's say, a good day and a bad day, and you're trying to figure out why was today good and why was the day before bad, is it a matter of circulation, or is it almost happenstance where you may have a good day and bad day? I mean, has medicine been able to pinpoint why that occurs?
Boy, those are three questions, Ryan. But so let me merge those questions and say that there probably is some identifiable thing that happened. Often we don't recognize what that is. People often tell me, I went out and I, swam, I jogged, I did this exercise, I was on the stationary bike, I felt fine. I fell asleep on the couch, I woke up in agony. So sometimes the trauma is not a recognized trauma. In body position, body mechanics are very important. If you've got a back problem, you should sleep. You should always try to sleep on your back. And if you have a back problem, you should put some pillows under your knee so that your pelvis is flexed up. If you must sleep on your stomach, then you need to put a pillow under the stomach so once again it flexes the pelvis and it doesn't extend the back, because a lot of times as we get older we can't tolerate that extension. And if we're sleeping on our sides, we should have a pillow between our legs as well if we've got a back issue. And try not to fall asleep on the couch where there's very poor support. Try to fall asleep in a firm area. And on hot days, don't fall asleep in a situation where the air conditioner or a fan or something is blowing on you, because that's probably not a good idea either.
So any change or any changes that may cause a discomfort that you don't necessarily notice immediately may be having these effects on the joints that are continually bothersome to you.
That's a very smart comment, Brian, because it's not just what I've mentioned. Each person should keep a little notebook and say, okay, I had a bad day today. What do I think was responsible for it? And then over time, develop a do and don't list that may be specific to that particular individual. I mean, the general guidelines that I gave probably are applicable to every patient, but then each patient is going to be doing a whole bunch of other things. And mechanics is very important. Understand that sitting and leaning forward puts the highest pressure on your spine, on your discs. So sitting, leaning forward, not good.
As I'm doing right now.
As you're doing right now. So in terms of the pressure on your back, sitting and leaning forward, you have the greatest intradiscal pressure. Sitting would then be greater than standing, and then obviously lying down would be the least. And then the other things that affect your back is obviously lifting, and the lifting could be, due to things that you're having to lift around the house and lifting. And then if you lift in a bad position, if you're lifting while you're leaning forward, for instance, you're working on a car leaning in and you've got to pull something out, that's probably not a good position. And then vibration too. We know that that vibration is not very good for the disc, the joints, etc.
I know you espouse right off the bat weight loss, and because that is just such a heavy impact, I guess, for lack of a better way to say it, on joints. I mean, all that downward pressure, and then it would just seem natural that if you were to remove some of that weight, that pressure, that things would respond positively.
Well, Brian, every patient comes into me and says the number one thing that they can't do is lift. And lifting is going to be the worst thing. It's exposing your injured area to force, whether that injured area is your knee, your hip, or your spine. That's going to aggravate it. And if you're aggravating it every single microsecond because what you're lifting is your body weight or excess body weight, then that's a problem that's going to prevent recovery. You have to think about the fact that, whatever your philosophic or religious beliefs are, we've been on this planet in some form for about 100,000 years. Mm-hmm. And prior to the year 1900, there wasn't much in the way of obesity. Maybe an isolated, king here and there, but the general population wasn't overweight. And still today, if you go to places that have very little Western influence, you don't see obesity. And so your body, it's new. It's a brand new thing. This extra stress, it takes a long time for evolutionary changes to occur. And this is a very new insult, let's call it, to the body, to the joints, to the spine. We haven't adapted to it, and we probably won't ever adapt to it. So it is very important. And not only that, but the other thing that's important is aerobic fitness. Exercise on a daily basis of some type, low-impact aerobics, swimming, high-speed walking, something to get the circulation going, something to clear. So why does aerobics work? Well, two things. It's diluting out the inflammatory factors, the circulation is, and it's producing natural occurring pain relievers called endorphins that also try to dampen out the pain. And then in addition, you get, torso strength so that you're able to do things easier. It's very important to have quad strength so that you can ambulate. People always talk about, are you successful in teaching your patients lifting techniques? I no longer try to teach lifting techniques. What I try to do is tell the patients to get their quads as strong as they can possibly, their quads and their hamstrings. And there has to be a one-to-one relationship. Your quads should be as strong as your hamstrings. That's the thing that you concentrate on. If your legs are strong, you're going to use proper, everybody knows what proper lifting techniques are. We're taught this our whole life. Don't bend over, squat down, et cetera, et cetera. But the stronger your legs
Lift with your legs.
The stronger your legs are, the more inclined you are to use them. People that don't lift properly have weak legs.
You are on the road to better spine and joint health with the Spine Doc, Dr. Pasquale Montesano, MD of Montesano Spine and Sport, with offices in Palm Beach Gardens, Naples, Miami in the Sunny Isles area, and now in Beverly Hills, California. Dr. Montesano specializes in diseases and disorders of the spine, scoliosis and other deformities, cervical, thoracic, and lumbar trauma, kyphoplasty, surgical treatments, and more. And I want to follow up a little bit more about talking about what can cause inflammation and how to alleviate it.
I saw a gal yesterday in the office who she came to me, obviously I'm a spine surgeon, because she had back pain. And the one thing that I do a functional assessment. So I'm watching the person even walk into my office, how they close the door, how they sit down. And to some degree, I've already done a lot of my exam before they're even in the treatment room. I'm constantly watching them. I walk around the room. I have them follow me. I see whether they can bend their neck, are they bending at the torso, where are they bending to follow me. And I had this gal, walk up and down the hallway, and then I like to have them walk on their tiptoes and then walk on their heels, etc. And she couldn't even, she had such severe bunions. And once again, people can have severe bunions and not have pain, but she had severe, painful bunions. And she had, so there's this beautiful girl, hardworking, single mom, and she's got this completely abnormal gait, and this is what's causing her to have back pain. And so anyway, I think shoe wear, foot deformities, it's all part of a continuum, and it's if you have bad biomechanics in your gait, in your posture, in your stance, this is going to lead to a multitude of problems.
If you want to know more about Dr. Montesano, his treatments, his methods, his training and background, outstanding, you can go to his website, spinedocs.org, or give the office a call and make an appointment. Maybe you just need a second opinion. Maybe you like what you're hearing with Dr. Montesano on these programs, and you want to give him a try. Come in and let him do an evaluation and see if he can get you on the road to better spine and joint health. 866-79-DR-SPINE, 866-79-DR-SPINE, or you can visit facebook.com/Montesano Spine and Sport. A lot of information on there about what Dr. Montesano is doing, a lot of tips, a lot of anecdotes, patients weighing in, reviews and such. So that's good information for you. But we do urge you to check Dr. Montesano out. We know you're going to find that his CV, his background, his training, his expertise is all top of the line. Don't just take my word for it. Now, I did want to move forward a little bit about inflammation and how to treat it. And one of the popular methods of treatment these days for nagging spine and joint pain is stem cell treatment. And we've discussed this time and again on this program about the inaccuracies about the science with stem cell treatment, and that a lot of doctors are promoting this. And as a matter of fact, I just saw in the paper over the weekend a big full-page ad about an upcoming seminar to discuss a new treatment for joint pain involving a PRP, platelet-rich plasma treatment, stem cell treatment, and even claiming that it can even treat osteoporosis. Now, I know we've talked about this, and you have done, obviously, a lot of research because you back and stand by the alpha-2 macroglobulin treatment because it is based in real science compared to some of these other treatments out there.
Brian, I had a problem with my car the other day, so I brought it into the shop, and I was just listening to people that were looking at different cars. They were potential buyers, and they were looking at new cars, used cars. And I noticed that increasingly people, consumers, whether it's a car or a stereo or an electronic appliance or a computer, they're very knowledgeable. The public is going in and they're very knowledgeable about the car. They're very knowledgeable about what computer they need. But oddly, they don't do the same research when they go to the doctor.
Well, it's because they trust doctors. I think there's an inherent, trust associated that they're going to take good care of you, have your best interests in mind, and not lead you down a primrose path.
I think that's a good thing, and I think you should trust your doctor. I think that the doctors have a lot of training and experience to impart. But I think in my practice, the more educated, the more informed the consumer, I think the better treatment they're going to get, because they have to be an active participant. It's not, there's decisions that they have to make. Informed consent means you're giving the patient alternative treatments and they have to decide what's right for them. Mm-hmm. In the same situation, if you're a competitive athlete and you've got, let's say, a herniated disc and you can't compete, you may want to get that fixed surgically so you can get back into the game, which we see time and time again. If you're not a competitive athlete, then for that person, the correct approach is to wait longer because they don't have any pressing issue that they've got to get back to. So I think what I would tell people is this: do your research. If somebody's talking to you about PRP, go to the American Academy of Orthopedic Surgeons website. I believe that's AAOS.org, and click on PRP, platelet-rich plasma. And what I've done that recently. What the website says is that there's many, many studies out there. None of them conclude that there's a positive effect that's been demonstrated at this time. If somebody wants or is looking for or entertaining a stem cell treatment, then I tell them, go to the FDA's website, read what that has to say. I've done that recently. I believe that there's only one approved, and it's the cord blood that when you have a child, you can have that blood saved.
Placenta blood, right?
Yeah, from the time of birth. And then if you're going to be given a stem cell product, or if it's sold to you as a stem cell product, ask for the package insert and have the doctor show you where in the insert it says stem cells, because the FDA monitors that, and most of these products don't say stem cell. They say active cell, progenitor cell, because there aren't stem cells in the product, even though they're being sold that way. And if you Google University of California, Davis stem cells, there's one of the professors there that is kind of policing things, and look at all the stem cell clinics that have been closed in this country. So understand that there's a lot of stuff that's being sold out there that isn't necessarily what all it's cracked up to be. The other thing is, when in the future we do have bona fide stem cells, think of them as immature, which they are, little children. They're like babies. And when you have an inflamed knee or an inflamed back, there's a war going on. So before you put these stem cells into that injured area, you're going to need to do something to wipe out the war. So this is where alpha-2 macroglobulin comes in, A2M, because that's what alpha-2 macroglobulin does, is it destroys the inflammatory process. And as you know, that's been published. Right. It's one of the best papers.
Which sets it apart from these other treatments.
Absolutely. Okay. In fact, there's a guy, Robin Young, who's a Wall Street guy, who said a year ago or so that the only biologic treatment that has scientific proof that it works is alpha-2 macroglobulin, A2M. But in the situation where there are active stem cells, and you're going to need hundreds of thousands of them in that vial. It's not like you'll need like 10 or 20 or 100 or 50 or 1,000. But when it comes time that you do have stem cells, that we do as a society, when the FDA has okayed stem cells, there's going to have to be some type of pre-treatment, in my mind, before the stem cells are given. Otherwise, they're just going to get killed. If you take these little babies and you put them into a war, they're not going to be able to defend themselves, and they're all going to get wiped out. So something's going to have to be done to the joint to stop the inflammatory process first. Wait a couple of weeks, 2, 4, 6 weeks, and then give the stem cells. That would make sense to me, but now I'm theorizing. So I think what individual patients want to do is go on, do their own research, ask what's been scientifically proven. So, doctor, what is proven? What of what you told me, what are you telling me that's in your experience? Because that's worth something. I want to know what your experience is, but I want to know what the scientific community says, and I want to know what the FDA says, and I want to know what the American Academy of Orthopedic Surgeons says, and then make your decision after you have become an educated consumer.
Yes.
That's basically my answer, is become an educated consumer and find out what's approved and what's not approved.
Now, and getting back to this ad I saw, and of course there was a little disclaimer asterisk at the bottom saying some patients have enjoyed success with this apparently patented treatment in this case, and not necessarily, no mention of the FDA in the ad that I saw, but some patients reported improvement, others reported little to no improvement. So it's kind of like, it's out there, and, try it if you want, but I imagine it's not cheap. And, for kind of that type of risk-taking, it seems like you're really, taking a big risk with probably little to no return.
Well, I haven't really seen or studied the ad you're talking about, Brian, but I can just tell you in general, if you're going for a treatment, whether it's a discectomy, a fusion, whether it's an exercise program, whether it's an injection, whether it's you're injecting with high hyaluronic acids, ask questions. Become an informed consumer. That's basically my answer.
Well, I did want to let people know, of course, you do offer alpha-2 macroglobulin to patients who you've deemed that it might be helpful to. So that's one of the mainstays of your practice as part of an overall approach to getting people back on the road to good spine and joint health.
Correct.
In that regard, when a patient, well, first of all, let me just say that you can contact Dr. Montesano's office if you want to find out more about the A2M method, or if you've had a recent trauma, if you've had nagging back pain or disc pain or joints or whatever. Contact Dr. Montesano. He is one of the most highly trained and renowned spinal surgeons in the nation, much less his orthopedic practice, which is, again, specializing in treating ongoing neck, back, joint pain. And find out more about what he has to offer. Maybe set up a consultation. He'll be glad to meet with you and see if he can design a program that will help you out. You can find out more information by visiting his website, spinedocs.org. Go into Facebook, facebook.com/Montesano Spine and Sport, or just giving the office a call, making an appointment, 866-79-DR-SPINE, 866-79-DR-SPINE. We urge you to take the steps and find out more information about Dr. Montesano and see if he's right for you. That's going to do it for this week's show. Dr. Montesano, we look forward to speaking to you again next week.
Thanks, Brian, and let's all stay fit out there.
You've been listening to The Spine Doc with world-renowned orthopedic surgeon Dr. Pasquale Montesano, MD. For more information, visit us on the web at spinedocs.org. That's SpineDocs.org. Or to make an appointment, call 866-79-DR-SPINE. Join us again next week for The Spine Doc, putting you on the road to better spine health. Better spine health. Better spine health. Better spine